This is live. All right. Some feedback to me. All right, welcome everybody. Thanks for joining us on the Older Vermonters Caucus, the first one of our 2026 legislative session. Just wanted to point out a couple of things before we get started. Something that we've talked about here at the caucus in the past is the H13 rate study that has been released. Looks at home and community-based providers and the reimbursement rates. So I just want to let people know that's out. Been taking a look at it, and I will send it out with the meeting, kind of wrap up information. And I also just wanted to quickly introduce Ren Tatro, who's intern from UVM. I'm working with this session. There she is on screen, right on. Thank you so much. Ren is working with me and just trying to keep track of bills that are moving through the legislative process that have direct impact on or supporting older Vermonters. So if something comes across your desk, you see, and you maybe we should be keeping an eye on a bill that you might be following or see, send it our way. And then also anything in the budget as that gets rolled out, happy to just send it out to the group so we can all kind of keep an eye on it. So today, our first one, welcome to
Tanya Vanderlinden.
Tanya, I'll turn it over. I'm trying to read your name. Sorry. I'll let you introduce yourself and we'll turn it over to you. Thank you so much for being here today.
Great. So I'm Tanya Vanderlinden. I'm a geriatrician at University of Vermont Medical Center. I work there and at one of the nursing homes in Burlington. My colleague Amy Gennari is also online, and we could potentially answer questions later on. I'm not going to so much give a presentation as kind of talk through some of the issues that we feel are important. I suspect it aligns well with what others in the room think is important, but I figured we could have a conversation. I wanted to start out by talking about what's called age-friendly health system. It's a perspective that geriatricians have tried to embrace over the past 7 or 8 years, initially proposed by the Institute for Healthcare Improvement, along with the John A. Hartford Foundation and the American Hospital Association. And the focus is on 4 main categories that are can be both screened for and are actionable. The first is what matters to the older adult and their family, and to make sure care aligns with those priorities as much as possible. Mentation, so screening for delirium if someone's in the hospital, depression or dementia in all other settings, and acting on it. The third category is mobility, making sure that older adults remain physically active and staying as able as possible to manage their own activities of daily living and to reduce the risk of fall with injury, which is such a common reason to end up in the hospital. And finally, medications, which really is more about what physicians and pharmacists can do, which is avoiding medications that affect mentation and mobility and align with the care that matters. When we see older adults in any setting, almost all want to be in their home as long as possible. Nobody wants to end up in a nursing home, and I think everyone in the room can relate to that. Our priorities would be to try to do as many things as possible to maintain independence, or give the supports in the home that allow the patient or the person to remain either in their own home or with family. So if we translate that to the community, that often means social connection. So what matters often is connecting with other people in the community as well as with their family members. community health centers certainly play a critical role in that. And I realize it's only a % of older adults that participate, but it still is very important. Outreach by community health workers can be incredibly effective and is not necessarily commonly used in all states to the same degree that it could be. So it's people checking in on people. There is a scarcity of adult day programs, so ways to manage caring for older adults with either cognitive disabilities or physical disabilities, so that family can continue to take care of them during the other hours of the day. Meals on Wheels is a critical component. And so other there are communities that use EMTs and or fire departments to do home safety evaluations, kind of help connect people with people who can do work on ramps and install handrails, try to keep the home as safe as possible. But those are things that are sort of sporadically done in different communities. And the question is always, how can we make this more available to people? On a different sort of part of the concern is for people who are getting older and are having more problems with disability, again, either physical disability or cognitive disability, knowing about and having access to choices for care is important. And part of that accessibility is making sure that providers, nurses, social workers know about the options, know how to talk to older adults about the options, and making that available in a timely way. Certainly, we see people in the hospital where that has not happened. People don't have advanced directives in place. They don't have durable power of attorneys named or financial powers of attorney. And we end up in a crisis situation that delays being able to discharge from the hospital or be able to be cared for in a way that supports what people might want. Other options that are out there are home share programs. So being able to expand the home share program can be a very effective way of allowing people to be in a setting other than a nursing home. And Vermont does not have a geriatric workforce enhancement program specifically. The closest one is Dartmouth, although they do train people in the part of Vermont closer to Lebanon. But again, being able to expand a workforce training program, help care for older adults is critical as well. Yeah, so I thought I'd sort of bring those topics up and then let people ask questions, talk about what they know, get a better understanding amongst ourselves about the issues at hand.
Yeah, thank you. I was just reading a report last night, which I think really ties back into your point around social connectedness, and it's around access to hearing screenings and how it's directly related to just not being able to have good conversations with people and how that ties back into Alzheimer's even. So I was wondering if you could expand on that, or maybe people want to talk about, and maybe we'll have this as an upcoming discussion around how do we make sure people have access to hearing screenings and hearing aids, because this report, which I'll send out with everything, really identifies that as kind of where we're missing here in Vermont. So
yeah, so hearing screening is generally done by audiologists. There are kind of handheld devices that can be deployed by other providers, nurse practitioners, physicians' offices to do a general screening. And it really, so it's a great point. There may not be an audiologist office close by, so being able to expand it to other providers to do that initial screening can be helpful. As you all probably know, most hearing aids are not covered by health insurance. Some of the Medicare Advantage programs partially cover it, but in general, it's not a covered benefit. But it's important, very, very important. And then these days, there are more over-the-counter devices that can help amplify, which at least is a starting point for a lot of people.
Mhm. Representative Bishop.
Can I say something?
Sure, one moment.
Yeah, real quick.
Yeah, just if there was some reference you made to Dartmouth Hitchcock and a workforce program, a geriatric workforce program, I think is how you refer to it. Can you share
Yeah, it's
a little bit
called,
more?
yeah, so there's a federally funded program called the Geriatric Workforce Enhancement Program, GWEP, or GWEP. And Ellen Flaherty out of Dartmouth, who's a dynamic educator, runs that program. And they try to, again, train non-physician, non-nurse members in caring for older adults.
Thank you.
Yeah, go ahead. Was that Joan? I think I heard.
Oh, yeah, I just wanted to say, yeah, the access to hearing screening is really nice. But like Tanya just said, so you get screening, now you know you need hearing aids, but you cannot afford them. The basic hearing aids today cost a minimum of $5,000, which most older adults who live in Vermont and do not own a business or have a rich inheritance, they are still not able to hear because they can't afford the implements, because the insurance companies will let you get screened, but they will not pay for any instruments.
Mm-hmm. Yeah, and this report addresses that. So I'll definitely send that out. And I also noticed there's some discussion in the chat, which is excellent. Just trying to figure out how to get my iPad to turn the volume all the way down. Not getting feedback.
You know, I'm going to shut myself off because it really reminds me, if I go to if I went to a pulmonologist and they said, oh, you need a heart, you know, you have to get a pacemaker. So do insurance companies not pay for the pacemaker?
Yeah.
Okay.
Great point.
I'm quiet.
That's okay. I think audiologists now can make recommendations about the over-the-counter devices and help people tweak them. But I think they haven't come out to the degree that we all had hoped when the regulations changed that would allow more of those to be available.
Yeah, and I know the VA does not cover them either. I have a constituent who reached out to me around access to a hearing aid and his experience at the VA, where he went there directly tied to his service for some help with hearing, and they noticed he had a Purple Heart, and they were able to provide him with a disability check, which he went over to the hearing aid store and said, "Will you take payments?" And got hearing aids. It's a kind of an interesting way to get to the end, which he was looking for. So, yeah, go ahead, Chris.
In my district, which is west in Londonderry and over in Winhall, we have a two-person, 1.5-person home visiting provider. She basically does it for free, but it's a kind of very small organization. The towns provide her a little bit of money for supplies and whatnot. But I'm wondering, because it's a hole in the provider network, basically for older folks. She goes around to do in-house consultations, and I'm just wondering whether there are supports out there for small providers like that that I should know about.
Not that I know of, but you're right that being able to have home care services is incredibly beneficial, both in terms of home health through the visiting nurse type providers, but also home health physicians or nurse practitioners that do home visits. The VA has a great system of home-based primary care, and it would be terrific if that could be replicated in other places, in other ways.
Jane, welcome.
Hi, Dan. Hi, everybody. My name is Jane Catt, and I'm the CEO at AgeWell. I'm part of the area agencies on aging in the state of Vermont. And just for point of reference, and I think it may have been missed, but the AAAs, the area agencies on aging and throughout the state of Vermont, provide exactly the kinds of reach out and supports that Dr. Vanderlind is alluding to. We work in partnership with home health. They provide the clinical nursing supports. We provide the social care. So we have case managers across all of our agencies. There are 5 of them across the state of Vermont. We use Choices for Care. We administer those programs, moderate needs programs, flex choices programs through our case management teams who have very large panels of vulnerable older adults on their caseloads. So, I just want to call out the work that they're doing because it is a really, really important link within our social care and healthcare network. And as you speak about age-friendly health systems, with the rural health reform that's going on, the connection between medical services and social care have to get more strongly connected through the work ahead. And I just want to remind everyone the AAAs plus our connections with senior centers, community centers, meal sites. We do Meals on Wheels throughout the state. We have all kinds of evidence-based programs that are going on in the community that we support and refer clients to with our partners at senior centers and other locations. This is a network that really everyone should know about. And we have a helpline, a senior helpline, we call it, and it's a number that anyone can call to get connected to services. So how we can promote that as we think about age-friendly systems, especially with CMS looking at age-friendly hospital designations now through the inpatient quality programs and core measures that are going to be reported and then required to be acted upon. The connections with the AAAs in the future will be really important. So just putting that out there. Wanted to bring up all the good work going on in the communities on behalf of older adults across Vermont.
Absolutely. Thank you for bringing that up.
I couldn't agree more. It's so important. And part of what I am hoping is that continues to be well funded because, again, money put upstream in the communities is much better money spent than in the acute care health system if we can possibly do it.
Well, here's one little snippet I'll leave with you. The investment in 1 year of home delivered and medically tailored meals that we deliver is equivalent to 1 day in hospital or 10 days in a nursing home. So just think about those financial metrics and know that that's just one piece of the system that can really affect change. It can improve health outcomes, especially if they're medically tailored meals. Managing chronic disease and illness in older adults. It keeps folks out of the hospital and in their homes with the right wraparound services. So Just wanted to share that too.
Yeah, absolutely. Andrea.
Hi, Tanya. I wondered if you could speak to the availability of geriatricians throughout the state of Vermont. A couple of years ago, we were incredibly fortunate for our dad's geriatrician at a rehab unit in Lamoille County in Morrisville, that geriatrician who was, I think, probably the best physician I've ever interacted with in any field. Um, Soon started working in the Hardwick Community Health Center, and he was able to have continuance of care with her for the remainder of his life. And having grown up in Lamoille County, I know that in the rural parts of the state, it can be really difficult to find someone like that. And I'm curious to know what the availability is throughout the state. Thank you.
I can probably let Amy jump in a minute, but I know in general, there are not enough geriatricians in the country, period. We did start a fellowship at University of Vermont for geriatrics a couple of years ago, but probably about half the spots in the US don't get filled. It's sort of not a, I don't know.
Happy to
Wait.
jump in and echo
Yes.
what Tanya just said. Is there's just a dearth of geriatricians, and from my perspective, part of the goals of the age-friendly health system is to promulgate these geriatric tenets to all primary care providers, right? And I'm not saying that we're succeeding in doing this, but that to me should be one of the goals. And I think we have managed to expand the geriatric division in the last 5 years, and we also have tried to do a better job coalescing the network as a whole, and the providers in some of our network nursing homes, and some of those physicians and APPs are also primary care providers. So we are trying to make those connections on a regular basis to see what we can do to help everybody be able to provide the care that do for these frail older adults.
I will also say, I think, again, if the state is thinking of where to invest, that probably investing in nurse practitioner training or a PA training in geriatrics would be money well spent, just because you can deploy to more locations with a lower cost of setting up a practice and that kind of thing. And they can always work with home health agencies as well.
Can I just follow up and ask us? I understand the general lack, but can you give us an idea? Does every hospital in Vermont have a geriatrician or not? Yeah. Okay.
No, they do not.
Not at all. And I should say, that we have been working with the NP program here, and we do train interested NPs in geriatrics for a part of their final semester. So we're trying to help with that process. There's a lot more that is needed.
Yeah, and it's interesting here, still talking about the need for doctors to provide these services. It must have been in 17 or 18, one of the early older Vermonter caucuses we had UVM Center on Aging come in and really brought up that point that Vermont's got this aging population, but no, we don't have a lot of people practicing medicine that supports people aging in the community. And he brought up Lamontia. It was Dr. Lamontia, that they were really trying to figure out how to bring people into that line of study so that they would continue providing a practice in Vermont. But and then back to how do we get more people? I want to bring up this report that I was checking out, and it said most people that go into nursing, they go in because their mom asks them or says, "Why don't you look at being a nurse?" And I thought that was a pretty interesting connection there. They were trying to track down how people got interested in nursing. So maybe we need to do like some public announcement from the Department of Health to tell all the moms to tell their kids to go to nursing.
I do see a question in the chat asking about medications like antipsychotic, benzodiazepines, et cetera, to older adults. I think the answer is that for people living in nursing homes, there are Medicare guidelines to continually try to decrease the use of those kinds of medications. In practice, the age-friendly health system is trying to encourage people to decrease and avoid those kinds of medications. And it was alluded to already, but CMS has new quality measures for hospitals to, evaluate medications that can be more harmful to older adults than they might be to younger adults. And that can include those kinds of medicines. So we'll be seeing more of those changes likely happening over time.
Mhm.
And I can also speak to that just briefly, that there's a quality dashboard that we're starting to roll out that's in real time, as opposed to sometimes CMS data is delayed. So in our network nursing homes, to look at that very issue. And the Division of Geriatrics is starting an ambulatory consult clinic. And one of the topics that we're trying to address is polypharmacy. And we're working with the Department of Pharmacy on that in a collaborative way.
Question.
Yeah.
Is there anything the legislature can do to advise manufacturers, or more appropriately, wholesalers, et cetera? You know, there are so many people that buy over-the-counter painkillers like Tylenol PM, which can make an older person almost comatose. And there's no warning, and anybody can walk into their drugstore and pick these off the shelves unknowingly, causing extensive damage to people 65 and over who take these. There's no
Right.
warning on the bottle. There's no warning given by the pharmacist. And a doctor here in Brattleboro has identified most of them. He himself contacted his 85-year-old aunt. She couldn't even talk, so he had to go over and visit her, and whereupon he found that she and her caregiver had been administering her Tylenol PM.
That's a
We're just
great
looking.
point. It's the diphenhydramine or Benadryl or other first generation
Yeah.
antihistamines that have adverse side effects, particularly as we get older. It
That's
increases
right.
the risk of falls and confusion.
And not just to that individual stumbling down the stairs or whatever. Some of these people still drive.
Mhm.
How many of us are interacting with them unknowingly on the highways? It's a general health and safety issue. Thank you.
Yeah, we've had some discussion in, around falls that are directly related to individuals' use of prescription medicine, whether they're using it as prescribed or outside of how it's prescribed, along with alcohol and drug use. Attributing to Vermont being really high falls for older Vermonters. We're one of the states that's pretty far up in the list, so not something to be proud of, but it sounds like we got some work to do for sure. Yeah.
I was just thinking back to the hearing aids. I mean, I've read articles about how they can help prevent falls, and also with social isolation being an issue in the older adults. It seems like there would be some cost savings there from the insurance company if they're circumventing those falls or other chronic conditions that can come out of social isolation.
Yeah, we definitely should have, I'm gonna have a discussion later on in the, probably after town meeting, around hearing, and we could bring in, maybe have someone give us an update on the report that just came out that really tries to identify, ways to help older Vermonters with access to hearing. Yeah, so what else is going on out there that anyone wants to talk about? We got a lot of stuff coming up this legislative session, so I'm sure we'll be continuing to have the Older Vermonters Caucus. As next week, we have Commissioner Bowen and some of her staff that will be here to talk about the department and what they're working on moving forward. And then after that, we thought about kind of identifying housing and how we can look at whether it's age-specific housing or access to just housing for older Vermonters here in our state. And maybe thought we'd do it as a panel discussion and have some people looking at not only building housing, but our permitting system. I talked to someone from a regional planning commission just to kind of round out the conversation. So those are some things that will be coming up, but what do other people think? What are some topics you might be interested in learning about or hearing about?
Well, since you brought up the housing, one thing that we haven't discussed yet is the cost of home modifications and equipment that is needed. And most of the time, it's out of pocket. There's some things that are paid for just once and never again. And so that's another barrier for a lot of my patients when they're trying to stay in their own homes, trying to get the appropriate safety equipment in place for them.
Mm-hmm.
It would be nice if some of that was covered.
Yeah, and I know Vermont Center for Independent Living really works to help people have access in their homes, and I have worked with them in the past on that. So yeah, home modifications are definitely important and kind of tie right back into Age Strong Vermont, where we really talk about having the goal of people, being able to age where you want. So can't really do it.
And I know my recollection is one of our colleagues will be introducing a bill to try to lower the local town zoning obstacles that may pop up for someone who's trying to create a ramp or something for access to their home, trying to reduce that administrative barrier.
The other thing I meant to talk about, but I know you all talk about, or the legislative body talks about a lot, is transportation within the state. That's obviously a major barrier to older adults.
Yeah, absolutely. I know that is going to be a topic in even Senate Transportation has talked about access to how we can do a better job at recruiting volunteers for our transportation providers and barriers to becoming a volunteer. So, how do we get the word out that this is a need to a lot of our providers?
Yeah, that's been a real crunch. I know that the town manager of Colchester, where I represent, has been in the last week before House and Senate Transportation talking about, unfortunately, the dwindling funds that are available for the O&D program, and I won't get them, I can correct, but serving older Vermonters and the disabled as far as getting to medical appointments, getting to work, shopping, and in some areas, some social visits. And unfortunately, the funding that was available for that program was used up in just the first half of the year. Transportation is a continuing struggle on all fronts. But it's more and more the towns are trying, I know some towns are trying to see what they can do to support continued operation of those transit opportunities to ensure that people are getting to appointments, as well as some of the social aspects of transportation or the need for transportation.
Can I raise one more issue?
Sure.
What are we doing for people who are suffering from dementia and their unpaid family caregivers who have to usually give up their jobs?
Caregiver support is definitely something we've been working on here for a while, no doubt. And I know that there's been a lot of the Alzheimer's Association has really tried to make that better supported here. But yeah.
Yeah, there's a lot I can tell you also from that side, because I run some, memory cafes, and I cannot tell you the number of times, whether it's White River Junction all the way down to Wilmington, over to Brattleboro and Chester, where they operate. When you sit in a room with the caregivers, it's hard not to watch them cry. They are so overburdened. They are doing it out of love. They're supporting somebody who needs to be watched 24/7, and they do it out of love. And they are dying on the vine. And once they're out of commission, who is going to care for all these people that are growing in number? Just like after World War II, when we got a bumper crop of kids, we built 1 million schools. What are we doing for these people who cannot take care of themselves, and their caregivers are overwhelmed and overworked? It's very scary. And the fact is, these programs are not even supported by any place. In senior solutions, we do, we have friendly visitors, senior companions, we have vet-to-vet visitors, and all the memory cafes. They don't get a dime.
Yep. No doubt. I agree. And hence, that's why I have the Older Vermonters Caucus, so that we can talk about these issues and really raise them here in this building.
Thanks
And
for letting me talk.
Yeah, no problem. Jason, you want to add to that?
Yes, hi everyone. Jason Palapita, State Unit on Aging Director with Dale. There's certainly a lot to say about dementia care and unpaid family caregivers in the state. But one thing I can mention is for the next state plan on aging, which is going to start October 1, 2026. The State Unit on Aging has put in a goal specifically dedicated to dementia care and dementia care coordination and navigation in the state. So I ran the draft by the Alzheimer's and related dementias Commission, and got some really good feedback on that. So that's going to be a prominent aspect of the next state plan on aging. And as far as services go, there's certainly Older Americans Act, unpaid family caregiver services that can be provided for family caregivers of people diagnosed with dementia. And also the AAAs have the dementia respite grants that they can use to get some relief as far as caring for their family members is concerned. But yeah, there's a lot to say about this topic, and a lot of concern, definitely, and a lot of work to be done.
And Jason, that we do get the grant, respite grants for people. They usually are exhausted within the first 90 days. There's such a need. Our volunteer visitors, 90% of them are providing respite for caregivers, because 90% of the people they spend time with have dementia. And you'll never get those demographics because they're not reportable.
Jason, are there action steps associated with those goals that you mentioned? Thank you.
Yeah, there's a number of strategies and performance measures that are part of the plan. I can certainly share that with folks. Dan, perhaps I could share that goal in the plan with you if you wanted to share it with people, if that works.
And maybe even next week, Commissioner might talk a bit about it. Not sure what, but yeah, please do, and I can send it out. That would be great. And then in terms of the state plan on aging, is there still public input being accepted on that?
So the official public input process, my plan is to launch that on April 1, and it'll be a 30-day public input process.
Great, but we can check the draft out, correct?
The draft is not publicly available at this time. It's a running draft that I'm still working on, so it doesn't really make much sense for me at this time to get it out to the public. But I have been sharing it with certain constituents and stakeholders when asked share.
Yeah, and when it is publicly available, just, well, we talk, so I'm sure you'll let me know, and I'll make
Oh,
sure
yeah.
people have access to it, that they can provide some public input on it, because I think would be really helpful.
Yeah, sure thing.
Thank you.
That's great. Those are all very important issues, and as geriatricians, we support all of these comments and suggestions.
Yeah, you can really see how kind of across all parts of state government, aging is an issue that we're all going to be dealing. I mean, what's his name? Kevin Chu from the Vermont Futures Project. You know, when we did the Age Strong rollout, like on that, you know, he talked about growing old. That is the goal, right? That's our goal, to grow old. So I always think about that now. So.
Right. And we also
Yeah.
talk about wanting to age well and then having a very steep drop off instead of
Yeah, right.
very prolonged, slow worsening over. Yeah.
Yeah, for sure. All right. Well, thank you so much, everybody, for coming today. Really appreciate our start here. I've got to figure out the volume on my iPad because you can't hear it, but it's really, I'm getting a lot of, so that's on my agenda for the next week meeting. But yeah, thank you. I see iPhone had their hand up. I'm not sure who that is. Do you have a comment or something here? Just caught it right at the end.
Sorry, Dan, this is Sarah Keating. I'm the Age Strong Vermont
Oh,
project manager.
Hey, Sarah,
Hi.
thanks for being here.
I just wanted to respond, in terms of the caregiving situation. I think that a lot of the conversation, and this is just my personal opinion, but I think I grew up in Vermont and I know a lot of my peers moved out of state. And now we are in an age cohort where our parents are in their 70s and 80s and aging. And a lot of, my friends' parents, for example, still live here in Vermont, but their children live out of state. And one of the challenges that folks face if they want to come back to Vermont and provide care for their aging parents is housing. So I think a lot of this conversation, moving forward will end up including housing to some degree, which I know we're talking about on other fronts across the state.
Mm-hmm. Yeah, thank you for that. So true. All right. Thank you.
Okay.
Everyone,
Thank you
have a
so much
great
for
day.
inviting us. Thank you
See you
for
all
inviting
next
us.
week. Invite your friends. Tell your representatives to come join us. They're all in the building. Have a good day, everybody. Bye-bye.
Thanks, Dan.